Let's go away. I will say let's go away. Hey! Murezi. I'm friend hey. Can I bring you Raise on. Move from no move jaja.
Something like that. We want the government to know that there's nothing like since 2022 in there. Those who are found in the world, we don't want to say that maybe they are being posted behind the door. But I want to let the government know that nobody has been posted since that time. So those figures there are fabricated, they've been massaged, and we don't know anything about it.
Attention, yes, no way was school. And yes, you know, I was practicing hospital. But I say, who is another because in Bakwa? Yeah, I was practice. We are supposed to practice what we learn in school. And this government has refused to post us. So if we are giving the government before election, we should hear good news from this government, or else we won't vote for them. Yes, we are not spectators.
Let's go, Presto, let's go. Let's go, lad. I'm the vice. Presto. Yeah, the many shows sound no. Yeah, the fence will never be wow. You want enter there?
posting.
It's raining and they are doing demonstration. The education nurses and midwives. President, our day.
Mr. President, you promise me, but I know they pay. I know they pay.
For the why?
I know they pay.
For the why?
I know they pay.
That's for the midwives. That's for you now. That one man. I'm about demonstration against the government. It's only solution. It's only someone come and see our rates. Taxi rank and say rate hospital.
Without rain, we are going. Yes.
So what another?
They have to. I don't know.
What was how many years?
We are 2020.
Not 20 years.
2020 and 2 years.
4 years.
Sure.
We are posting our second man. I say.
2020 you post you be a papa. We've not posted it because 2021 we are posting. We post you be a 2020 ni be a year adwuma be a be a the connection na year adwuma. Aban na free ni pemu nka say 2020 die me post you onye za yesra mo sa de mo hu ni na ye azan mo post you omo post yes so ma ka jom ma post you omo boa.
Eso do also ya post no so scam my allowance na allowance my.
Papa 2020 they've not posted anybody 2020. So what year 2020 ni na year adwuma na o sika my ya. Ye post you until sika free here na eba. What I say they've not posted anybody. It is one new people one why the connection why year adwuma na sika my ya. We are not fighting for those people. We are fighting for Yene. 2020, we deserve to be posted. Yeah, we are a national service. They told us to serve. We've served. They said where we had no moon post here. Second service, they would have punished us. But we serve Mother Ghana. We deserve to be posted. And yeah, thank you.
So we are midwife and answering this.
Okay. Thank you.
A Rich Hospital and a demonstration Rich Hospital Greater Accra. Now they are demonstrating against see a post allowance number and a boa material fee for several years. In post so much as say I feel I'm not starting so that papa to say or made the demonstration. So tell you it's where part 1 of the demonstration air personal. We saw it still a mujinum, the Brena neighbor. Yes, not a conversation say in 10, but in so no. The doctors will be out of the bed broad. They are demonstrating where rotational nurses and midwives and no more demonstration. I want to see the Brena is another. One person.
All right, so tell me, what are your concerns?
So we're actually here because we are all nurses. Since 2020, it's not been posted in the house and we are losing our skills. Our skills are deteriorating. The nursing qualities that we have learned, patients in the hospital facilities has been destroying. A lot of us have been engaged into galamsey, that's illegal mining, we've been engaged into Okada, that's riding of motor for our survival. So we need postings now. We want to let the government know that we are suffering. Nurses cannot suffer. Nurses trainees cannot suffer. Rotational nurses cannot suffer. And patients are also suffering. So we want the government to assist us.
How long have you been home?
We've only been home since 2020. Since 2020, we've been in the house. 2020 bad, NAC, deploy at home. 2021, they are still at home. Then 2022, we're completing their service this coming June. So all these nurses that we have over 60,000 to 70,000 nurses sitting at home. Why are we sitting at home? We need.
Have you gone to the authorities to address your concerns?
We've been to the authorities several times. These days, even if you go, nobody is ready to answer us. When you go, what they always tell you is, soon you hear from us. The soon is never coming. You want to know when that soon is coming.
Anyway, what's your full name?
My name is Apudu Frank Ati.
And you are?
I'm Accra something.
Thank you very much.
No posting, no vote! 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 No vote! No vote! No posting, no vote! No posting, no vote! No posting, no vote!
All right. Thank you.
Survive! 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 No posting, no vote! No posting, no vote! No posting, no vote!
Yes, still a. I was driving on the starting the demonstration and I myself. Oh, 9,000. Right. Oh, 9,000.
9,000. Nobody had it.
9,000. Nobody had it. 9,000. Nobody had it. 8,000. Protocol 8,000.
7,000. Well, when you know power campaign, I think
that's what it says. Hey,
my classmates not less than 15 or more years. Open baby, more park or Chag Hospital, Mission Hospital. A Honda man air force. Yeah, Obiano and a classmate, and 2022 for Moya National Service Crown. A minimum award,
that's a money 8,000.
Last year, me calling back to 9,000.
What's it?
Special post is 9,000. Oh yeah,
me say it's just a word by word, hospital by hospital. I could so be started and say, where am a classmate? I'm in the new school. Where am I mate? I'm in the new school. Where am I mate? I'm in the new school. Menya or be our same buano. I'm a friend. I'm no back hospital by hospital. Now, so I'm a same boy. I'm on for administrators. I'm on for administrators. No, I'm on for certificate of nurses. I have post to since 2022. I bet see now me no say 2020 nima, 2021 nima, 2022 nima. I said my account for the past 2 months. Esa say ya no currently. Ministry of Health, Entiminka Hohe. Ministry of Finance, Entiminka Hohe. Ghana ban penny for Entiminka Hohe. And then I auto pepe. Akwabi war. My friend Akwabi simple because me nimno. And the oil and Tisana, my friend. Also, a year more Winneba Trauma Center. Or catch us a year ago in a referral student. You have fairly exams near cultural party. And here they have my imagination. No, 2022 for a Mountain Award. Meanwhile, 2024 crying post 2 years. It is a corruption and a bribe in the Koswa. And Kayada Subufi.
Yent me say 8,000 na abaya for you.
I
I said, I'm make of course, we are anatomy and physiology. Anatomy and physiology, they can never be unwashed. Who says I also participate in what? Well, who also participate in anatomy and physiology, basic lessons, also participate. But what 4 years, oh, yeah, never feel over prayer. Well, indeed, I didn't hire. And then I problem get here. The one on my room. Yes, sir, I buy them. Sir, until yes,
you are the president. President.
We want to have a word with you.
Okay.
We are two groups that are here today.
Okay.
We want to clarify things so that maybe your presentation.
Okay.
So we have rotation nurses and midwives.
Okay.
And then we have unemployed, graduate unemployed nurses and midwives. So with the rotation nurses and midwives, we are demanding for unpaid allowances.
Okay.
You understand?
Okay.
And then
allowances.
Unpaid 9 months allowances. Yes, unpaid 9 months. And then the graduate unemployed, which we also belong to, are requesting for clearance for them to be posted permanently. I hope that is clear.
Okay.
So rotation nurses are for unpaid allowances. Graduate unemployed nurses and midwives are for permanent posts to be
Okay. So you are the president.
For rotation nurses.
Okay.
The PRO for
unemployed nurses.
They are present on there.
Okay, so you are the 2020 batch, right?
We are
2022.
2022.
So they are like, you completed 2022.
So we are doing our rotation. And we say rotation is just national service.
Okay.
So national service, we started July and we haven't been paid till date.
Okay. And the name is?
I'm a Black Kwame Jr.
Okay, and you are?
Sarah Mensah.
Yaro, okay. So you cost us years?
Yeah, Kwakwa.
and there's no one, Hello, please, everyone should be involved.
Wait, I die 0-1-0. It means I'm a premier divinity. And we are meeting by divinity. Then you know, rotation from here. I'm your Osa. Wait, Osa. Who did you know? 24 hours, one single meal, 24 hours. Wait, yeah, bread, have Joe, stomach Osa. Obi Praso, I don't compose Jamai, me where Jamai,
As a nurse, no one to answer.
Can you?
Hey, Mama Pony.
Mama Jimmy.
Don't say that.
Oh no, like we have to say that.
No.
And then think, would they put us through this stress?
So you shouldn't insult.
No.
You shouldn't insult anybody.
No.
Just do that the more. Don't insult, okay?
We've been working for 9 months now. Nothing. 9 months. Do you understand? Okay. 9 months. We've been working for 9 months now. No pay, nothing. And then our in charges also expect us to come to work on time. Whether you've eaten or not, I'm going to inform you. What you say? I'm going to inform you. And you know, you run on per se, yet it's near Quajuana, and I say, Bianana, Omoton, and Jessica. And Jessica. I believe that those that are there, I'm going to Martin. So what you say? I'm going to Martin. So said you are no mega some and conquer that common. That is how we too that we are appeal to. We are also expecting the same thing from them. It is very sad and it's very bad of them too. You understand?
I understand.
It's very, very bad and it's sad because like by this time I shouldn't be here doing this. But Charlie, I'm in here. Oh no, I'm in here. So what I say?
Say something.
Nanado, a comedy. Share, as a nurse, you go to the ward. It's not fine. How they are treating us is really bad. So we beg them, they should pay us. If not, you get straight.
We are suffering because even in school, some of us didn't get our training allowance. But still, we are working wholeheartedly. But still, there's no payment. You go to work and now there's transportation increment. So this one is going to bring so many things. So if you're not doesn't pay us, as my sister said, UK straight. My papers are ready. So I'm going.
But you're within the Atta Asante, Secretary General, Graduate Unemployed Nurses and Midwives Association.
Okay, now then, cost one say.
And then the air cost no, ye barbe tunte sukoko anasi ye barbe chere. Amagana many we are for never be a dear Ghana buying Ghana penny for ye di no moon in the year. And no who you were a graduates are yakogentity or nursing training a whole universities in nurses training colleges are all a work Ghana program near year school free 2020, 2021, 2022. Abepem na yem fire Jumani that's so etifi airbre. Ya try say ya bene penny for edding kita home. Near who near Omon fire Jumani that's so tifi. They ya Omon Maye, Aquaniam any ministers and I'm penning for I almost said. Ninkita home. Nansen cried their course on say, your colleagues need and I seniors in Pennyphone and our politicians be almost on my nurse for 80 group Bumu Air Casse. Precisely one guy war Winneba Trauma Hospital. Your friend Stephen Boating, essay, ya ye Jenna Henry, a referral student. I try exams see failure, Ben America, I'm a Ghana man unity. Say ya ye Casanina, Obian how a referral student. Say referral students crowd with you more. Omonsu decide omo de woman Ghana edema omo ye nyina ye nurses aya graduate ye wie school ye national services awie na hese makogente ye 2 years 3 years 4 years number 3 year 4 years ye mikosu ya ni nyina pro referee meeting me amene wo kasa me de me de eso concrete obi de ne de edi made obi de ne de eton wade e ba sa enye Ghana apomodin adwuma na yede etoto amenam yesre Ghana mpanimfo omo mehweye ye nuanom nketo a omo awie school omo ye national service obi afri kroma akotena tumu obi afri akotena tamale watena hat wakotena kromo 8 months 9 months ebi 10 months up to now na allowances ye de ma no ye man bi na so wakotena ho onye den wa ye adwuma onye den watu ya ne light bill onye den watu ya ne rent ni nyina ye ho enhia ensem fataye nurse so mo ni ye ni ye ye nya politics ntine wo ha ye hia ne say omo ma ye clearance ni enko hospital enko ye adwuma ni enuanom nkuma nso omuntu omo allowance mfa mo omo beda wa
say benefona mfi ma na me
say ye omo mfi ye na ye ma na otwe mienu se mpanifo mfi ya ye be say demonstration ni bio
so ma mfi ma still am be ya
ye be ya to se mpanifo beti ye nka na omo age ye so
na nyanti say mamwa no me ye rotational nurses and midwives na Cabo men okay.
Rotational nurses ni ye nua nketo na omo ye national service no.
Okay.
Ekunya ye kunya na omo nyina akon no. Nti omo nyina akan ye nti na America sa me ma ya aware say. Omo nso kra kwatana hospital 8 months 10 months. But market years omo nsaka no. Omo nsa enkan. Nti na ye nyina aka bomu say ye to ntasu kokko akira aban ne mpanimfo. Na omo hu say ye nso ye ho kire ye. Ye nuanom nkuma nso ho kire ono. Eno nti na ya ba abonte.
So please, let's remain silent. The PRO of the meeting, so let's create our awareness to the camp. We still make noise to the camp.
The Minister of Health just came to us that he is going to see the Chief Director. He will be back with us within the next 5 minutes. So we should be quiet for a while whilst we are waiting for him. Thank you.
What would you have seen when you don't have enough? Let's go home with clearance.
Ya bro, they need 10,000 and debate to your mom after you do 10,000 ye ni bio. Me mami ye hiani o. Me papa ko ko nyina ahye o. Me ni sika me debate to 8,000 and 10,000 o. Me mami ni bi, me papa ni bi. Oh yes. Me mama to na japade ansa na ohwe me school. Various schools say me tia 10,000 ansa na yakoma adwuma. Ya bro, ya bere. Ye ni anu mo ye adwuma no mo ni special qualification bi ansa na ye. E say sika mo qualification na ni so mo tia sika. Ye ni sika e di betua. Ye ni 10,000. Ye ni 8,000. Ye ni 8,000. Ye ni 7,000. Ye so ye deserve say e be ko word akoye adwuma. Ya kwajente siyasa ya kwa kurasi ya kwa ya juma. Ya kwajente siyasa ya kwa jie ni ano maawo. Ya kwajente siyasa ya kwa haya refo. Yankojente Tiasia de Betu Okada, Yankojente Tiasia de Koyatro May, Yankojente Tiasia de Basua Concrete, Minianum Yabro, Yabre, Abanam Panifontia Supra, Panifontia Supro, Panifrontia Supro, Yenny 10,000. You need 10,000. And yes, I have failures and so. Yenina, ya pass it. Yenina, ya pass it. Ya pass it, yes, ya national service every year. You have to have a ward up for your Juma. The Akane say, Benya clearance. You need 10,000 dear, that's what if you need 8,000 dear, that's what if you. Ya bro, ya bre. Yenian Mukuma, Moya national service, and so you allowance. Obia for the Nitia cotton will be crosso. Busumi do. Bosome Water, Onya the Odibedi, Obeda for Juma. The in charge in the house of Juma. The in charge in the house of Juma. Only the code from car, Obeda for Juma. Only the code better than the idea, Obeda for Juma. Yet you run move 2 years. Yent me fast certificate in Kotoma Co. Yent me fast certificate in Kotoma Money. Yent me fast certificate in Koyafu. Yakojente Tiasa, nursing. Yeah, midwife. A Jumana, I see a final hospital. And your form the FIA Yano. And your Jason the FIA Yano. Mr. Ramo. Abam Panifomuntia Supre. Abam Panifomuntia.
They want to come the corners because you said to me, and I feel a move for here. Then I was a moon check, but a moon check, how I have bread. Come on, dear. It's coming back. I was why is this why you need
Good morning. Good morning. We are Graduate Unemployed Nurses and Midwives Association and our junior colleagues, Rotational Nurses and Midwives nationwide. We are here this morning to present the petition concerning the delayance of our posting and then the delayance in the payment of our junior colleagues' allowance. We've been home since 2020 after school. We've been seeking to know why we've been delayed, not posted. That is our mission here this morning.
So I'm taking the petition on behalf of the sector minister and then the chief director.
Please, your name.
My name is Dr. Kwesi Asare, Director Human Resources.
Okay, thank you.
Dr. Kwesi Asabel, Director Human Resources.
Okay.
So I'm picking it on behalf of the caretaker minister, Ramu Okuboy.
Okay.
So I want to tell you that the caretaker minister will surely see your petition and will do the needful. Yes, thank you very much.
Thank you. We are looking up to you to hear from you very soon because we had a news or a colleague who is a nurse, equally a nurse, who is working at Winneba Trauma Center, Stephen Boateng, made an audio to a platform that you said, or the ministry said, they've posted all batches of nurses, aside the 2023 and 2022 nurses who are doing their rotation, that they've posted everybody. We, those making names, are referral students. But I know myself, I'm a graduate, main batch 2020. I've not been posted. And what we also know is that some of our colleagues I say some of our colleagues because my mate that I help the person doing his or her case study is now working in a hospital. I asked the person and he told me it was a special posting. We don't know the kind of special posting is that because I have the same certificate the person has. We all have diploma, we all have degree, but he is working. I can say more than 15 of my colleagues that I sat in a class, I sat for them in the same exams with them, are working in the hospital, but we are home. We have been investigating it and we find out that they paid money. Huge amount. They paid money, not less than 8,000, not less than 10,000 to people within the Ministry of Health and Ministry of Finance to get them clearance and for them to be posted. For this, I'm saying it per what I've seen and per what I know. And all my colleagues here can testify to what I'm saying. It's not only my mate. A lot of us, we have mates who are working in the hospital. So we are waiting to hear from you very soon.
Is this part of the petition?
Yes, please.
Then it will be investigated.
Yes,
please. It's an allegation.
I'm ready to be called upon to. I can take you to any hospital that I know.
We'll take your particulars and you help us to investigate.
I have no problem about
that. Thank
you
very much.
You are welcome.
Thank you.
We believe in God.
We believe in God. And some of us are tools in the hands of God to be used.
Please, another petition comes.
Caretaker minister. For further action.
The rotational nurses. The rotational nurses are also bringing their petition.
Okay, where is it?
Hello.
Let's wait.
Oh, go back there. So we are here.
I would like to read out what we have for you so that
put it here.
we have your copy.
We'll give it to you.
Okay, we have a West. This is ours. This is your copy. So we are rotation nurses, just as stated in the letter. We were posted in July 2023, and as we speak, we are 9 months into our service without any of our allowances. Our concerns have been written to the ministry. Follow-up letters were sent, but to no response. We consider that as a neglect because these are your children. This year, we here we see you like our father, and we've written to you about our concerns. We are hungry, we are starving, we are walking to work. Our landlords are sacking us from their room, and you've not responded to us. That is why our members have decided to come to you this morning to present our grievances on this petition to you and then the ministry. We are looking forward on your active engagement with the Ministry of Finance to actually release our financial clearance so that we will be paid. We trust in you and we hope to hear from you in your
Thank you. Now the PRO will take over.
Allow this guy because he's been representing them in all the positions. So if you say that we don't respond So it's rather unfortunate that we've gotten to this level, but we are aware that we cannot employ without clearance from the Ministry of Finance. That also does not mean that we've not been working to ensure that we get adequate clearance in carrying all our nurses that are unemployed, especially the project that. We have enough letters, documents to show that after we've received the list from NMC, we forward that to the Ministry of Finance. This is the leader who always comes to negotiate on their behalf. So he can attest to the fact that we have given him copies of evidence to show that the Ministry of Health is committed into ensuring their recruitment and ensuring their postings. It's rather unfortunate that some allegations have been made with regards to bribery and then the collection of money that could lead to postings. And that one, we can assure them that the ministry would investigate and come out, sanction officers that may be involved. However, nobody is recruited on the basis of payment of money. That is not the process. You go on the portal, you receive your information, you put in your data, and per the data and the vacancies available, you are posted. And so nobody is attributing postings and recruitment to collection of money as a practice here at the ministry. And I think that the caretaker minister, Honorable Ursula Wosu, the chief director and the government would make sure that whoever that is involved in this particular allegation will be sanctioned. Regarding the rotational nurses who are working at the hospitals now, we are assuring them. Last year it happened. The 12 men that they stayed at those hospitals were paid. There have been issues regarding the uplift and downlift, which were resolved somewhere last year. And this, you were part of some of the meetings. So it will be difficult for the ministry to say that you are posting your children to go and to do rotational nursing or nurses working. We know they are renting, we know they have to transport, we know they have to feed. But the ministry will be here and say that we're not going to pay. Hello. It's not going, it's going to be very difficult. Some of the directors, including some of us, are parents. And so if you have your son or daughter outside that is working without payment, it's difficult. So we are pleading with them. We are working on that. And we can assure them that the government is committed to ensuring the payment of those allowances. All we want to assure them is to give us time as we pressure the negotiations. And we know that those amounts regarding the allowances.
Mumble, anointing one shop. What you university? And now will university and now will poly and now will maybe Biela will Biela. Blah, anointing one shop. So you are blunt here. Now what's so? Now when you school, that's always can be the hole. And now you are Benjamin Pom time. Blah, anointing one shop, then found WhatsApp group. The two are being prices, no. Now it's what post them and for now when you Accra. And their child school fees. When you Accra, and yet be an old child mammy and now papa. And try by you and chill be I had night to football to make fun on one shop mamma. One will yet Juma and Lanty and Mabawa. I'm a number bench, and then a bench to be moved. You walk top and down. You were t-shirt, you were shirt, you were boxer, you were singlet, you were joggers, you were jeans. You can't jeans, you jeans. And never can have by intimate. The word 20 shop for more. Hey, Papa Chaffam now, what 20 shop for more a phone. Why, I ain't any minimum. And your mother for any back. And she's on 1,000 cities, 2,500. You may be a bra, Mabuau, any baby. You will to a flower station, Who do a flower station? Because all here anointing one shop. Who call out open your bachelor. Name so here to find here for a number 0243 63 3885.
Etufuwa muba ebe ya mukama oba so hwe ma mi nyansa ya wo bag ya wo te say ya wo nyema bebre bitimi bi body ya wo nyema bebre ampa aboa edey invest for aya no mu nyina be fa nyama ton edi yo mu business
me we school am funu ma epe ntade nda ya ade ba no ntia na me ede me ba no na mu se nyama ede da fam so on ma na me funu dis kaka cry ede she mu am funu ede da start me business Accra. And to the baby, I'm going to be a umbrella.